All right, welcome back to the Reprogram Online. What we're going to do today is I'm going to take you through the mobility assessment on the Reprogram Online website. Now, the reason I'm doing this is because I want to show you the value that it can give you, and it's completely free. I don't know of anything like this on the internet so far, and I've done my research, hence why I ended up designing this website in the first place. If any of you guys know of one, feel free to send it to me. I'd love to see it. But as far as I know, this is the best one, and the one that gives you the closest kind of injury diagnostic, pain risk diagnostic dash consultation form if you were going to see a physical therapist or a coach that you can get without paying anything, and you can do it in the comfort of your own home. Okay, so what we're going to do is we're just going to log in. This is the home page, by the way. Again, there's a bit of multimedia here. You've got the three main phases of the reprogram system: reset, reintegrate, reinforce, like there. And then obviously you go down, you've got your testimonials, and this is what you get. This is the whole package. And so and I'll kind of highlight things along the way, but let's go into it. I've already registered, so I'm just going to go to login, and it's going to set me up straight away onto the mobility assessment. So here we go. So this is the reason we do it, right? The mobility assessment determines your current level of injury risk prior to physical training. Okay, it indicates what injuries you are vulnerable to simply by revealing the mobility your joints don't have and the positions your body can't access. Each movement is based on peer-reviewed clinical tests, which basically means the test I would use in a professional setting, in my physio clinic or rehabilitation clinic or coaching, whatever. It's what I would use to screen for injuries, joint pain, anything, right? Just to get an idea of how that body can move and accurately establish the relevant clinical outcome. These tests have been adjusted so that you can perform them without the external aid and costs of a physical therapist by using easily accessible points of reference such as a wall or the floor. You have a definitive marker for biofeedback, allowing you to measure your mobility and to see whether the test elicits a pain response, right? That is the purpose of a mobility screen, okay? Right, so let's go straight into it. There's 17 exercises, and what I'm going to do is I'm going to pass a few, fail some others, and it will give us a printout diagnostic at the end and tell me what my issues are. All right. So first one is, as you can see, this is what the mobility screen looks like. Okay, so you click on the play button here. There's this guy with an ugly mug, and you basically just copy, right? It's just watch and copy. Reps, 10 seconds, 1 set. Modified clinical test. It's got the clinical test below as well, so you're free to kind of research and see where I got these tests from, so you can see it's legit or whatever. And it gives you a direction of how to perform the mobilization, and then you just do it. 1 set, 10 seconds. Did I fail it to pass it? Yeah, I passed that. So I passed them all, but let's get real sort of where I want to be. Wrist extension, same deal. Yeah, I passed them. So what I'm going to do is I'm going to fail a couple of shoulders, fail a couple of hips, and then I'm going to go into it. So what you'll see is that you would have seen all these exercises on the 27-day mobility challenge. You would have seen these are the essentials, the ones that everyone should be able to achieve ideally before they start serious strength training. Okay, really important. Without movement, we don't have strength. If we can't move our joints and work our muscles through a full range of motion, we are not going to get a quality level of strength through mobility. If we can't actually if our mobility is terrible, what happens is it's just like pouring gasoline on a fire. It just makes things worse. We get tighter and tighter and tighter, and then eventually our joints can't move properly, and we get joint problems, impingements, inflammation, arthritis, you name it. So let's say I'm going to fail this one. I'm just sort of working my way through these tests. Let's extension. Yeah, let's pass that one. That's not a common one that people pass, so I'm going to fail that one. Shoulder extension, internal rotation is quite limited on most. This is especially particularly working in office. This is a tough one, so let's fail this one. I don't have to press play on all these either. I know what they are, but I'm just going to, for the benefit of you guys at home, you get to see what the quality is and what it looks like. Fail that one. That's not commonly passed straight away. External rotation, yeah, let's pass that one. So we're already 8 out of 17. What I'll do is I'll speed ahead, and I'll catch you at the end of the test, and we'll go through my results. All right, so I've worked my way through the mobility assessment. I've got my results. Okay, so let's have a look. We have got our underlying issues marked in red. So these are our causative factors, our causations. Okay, shoulder, hip, and ankle. All right, these are our main points that we want to target. Now, the stronger the indicator, the more of an issue we have. Okay, and then it also underlines our compensatory issues. So because we have quite a major issue at the shoulder, a little bit of an issue at the hip, and a little bit of an issue at the ankle, we have a bit of a potential issue at the neck. We have a bit of an issue at the lower back, possible issue at the lower back, and then a possible issue at the knee. Okay, so that is basically breaking down the biomechanical compensation issues that I'm liable for if I don't sort out these here. Okay, and here we go. It says here, so failed test: shoulder flexion and external rotation, direct risk, subacromial impingement, rotator cuff strain or tear. And these are the most common problems that we get and we see when we leave these unchecked. These are your highest risk injuries, okay? And then indirect risk, we are looking at lower back muscle ligament strain, all right? So if I don't fix that shoulder flexion arc here, particularly if I'm going to do something like an overhead press, if I can't get that arm vertical because my shoulder flexion is limited, the only way I'm going to get it vertical is by arching the lower back. So I'm adding excessive strain to the lower back, and that's what it realizes, so it's picked that out. And this program is not AI at all. It is all done by me. I created the algorithm for it, if you like, the automation. It is all done by everything in here. It is not an AI program. It is a program designed for humans by a human. All right, so it's all from my 10 years experience, knowledge, the lot. Okay, next step, shoulder extension with internal rotation, disc, direct risk, posterior capsule impingement, rotator cuff strain or tear. Again, if we're missing that internal rotation angle, the rotator cuff is in a bit of a vulnerable spot, and then the indirect risk is neck muscle strain, right? So another reason why is because if I'm missing that internal rotation there, the next thing to go when I need this range of motion, then the way I get it is by doing this. I shrug, and that's going to put excessive tension on the upper traps and the cervical spine. Okay, so it breaks all these down really clearly. Shoulder horizontal abduction, subacromial impingement, scapular dyskinesis. Yeah, if we're too tight in the chest, we risk getting a winging scapula. Biceps tendonitis, indirect risk, again, neck muscle strain. All right, and again, these are just like the most common. There are others as well, but obviously I didn't want to flood the screen with injuries and stuff. So as we go down, hip flexion, right onto the hips, hip flexion, external rotation, we are prone to hip impingement, femoral acetabular impingement, bursitis, piriformis syndrome, ITB syndrome, right? Makes total sense. And if you go to the YouTube videos where I went through the hip flexion, bent leg on the Mobility Essentials, I'll explain why you're prone to this. Indirect risk, lower back muscle, ligament strain, lower back problems, SI joint dysfunction, and patellofemoral pain, right? So again, it really does account for all these biomechanical breakdowns and compensation patterns when we do not have the necessary range of motion, the essential range of motion necessary for optimal performance, okay? And this is just the minimal. These are all just the minimal ranges of motion necessary to have before I start effective strength training. Okay, hip extension, massive one. Direct risk, SI joint dysfunction, hip impingement, piriformis syndrome. And again, without that hip extension, usually the joint above and below get affected. So we're looking at lower back issues, knee issues, patellofemoral pain because of the tight quad muscles, iliotibial band syndrome because it doesn't have doesn't have the strength of the gluteus medius for starters, or the glute max because we're not hitting that extension angle, and then the lower back kicks in to make up for that loss of extension. So yeah, and then ankle dorsiflexion on the ankles, pretty obvious stuff. Calf strain, tear, ankle impingement, medial stress syndrome because we don't have that dorsiflexion necessary. You're going to see that when you try and do things like squats, lunges, particularly the spasal squat. The spasal squat is present in this program, and without having that range of motion, you're not going to be able to do it effectively. Right, so, and as we go down here, what this means for you, pretty much what I said, but I'll read these out anyway. Failed test informs you of the joints and the range of motion they are lacking in. These are the underlying issues. This is where the potential problems in the direct risks and indirect risk columns originate from. Direct risk illustrates what you're vulnerable to at the joint in question if the underlying issue is not addressed. which is what we said. Indirect risk illustrates what you're vulnerable to in other parts of the body due to the underlying issue. So you can see it kind of all knocks on. You've got the cause, and and then injuries are the direct risk of that cause, and then the compensation patterns, the indirect risks. And then if you are currently suffering pain, the test that you fail will likely highlight the symptoms you have and show you the underlying issues that need to be addressed, okay? So remember, before we were kind of talking from I don't have pain yet, but I'm thinking of starting training, or I have started training, or I am training, and I have no idea what I'm at risk at, right? And maybe you've sensed a bit of dodginess in some joints, you feel vulnerable in certain positions, and this will tell you why, right? You lack stability in certain positions because you are not able to position your joints or organize your joints in a biomechanically efficient way to support your structure under load, okay? And then you are in pain and you are already injured. Sorry to hear that, but this test will allow you to see most likely why you're injured, right? It doesn't account for you getting hit by a car. That's not really what we're talking about. We're kind of talking about injuries that have come on over cycles and cycles and cycles of dysfunctional movement, poor posture, sedentary positions, things like that, okay? Chronic pain, not so much acute pain. All right, and then it kind of goes into what other symptoms your mobility can lead, deficits can lead to: stiffness, discomfort, muscle imbalances, decreased physical performance, postural problems, joint degeneration, psychological impact. Obviously, we were limited movement, we can't exercise, we don't have access to the full plethora of exercise and movements we want to do, which obviously would play with our mental health as well. And this is kind of like a video of what the program looks like after the assessment, like after you pay for the training. So you can go ahead and watch that, and it will basically show you exactly what the program does. So let's go down to what you can do about it stage, because what this does, so the mobility assessment allows you to gauge your current levels of physical health before you find out in the worst way getting injured, what you physically can't achieve or shouldn't even attempt yet. If you are currently suffering with joint pain, these findings provide a deeper insight into your symptoms, preventing you from making them worse. That's the point in the mobility assessment right there, okay? Again, if you can find something like this online that's free, let me know. But this is the magic of the Reprogram, okay? So, and we've already got, for free, we've already got tremendous value. You're literally your body is being diagnosed joint by joint and telling you what you're at risk at, which is another reason why I did this. I'm very much in the preemptive game rather than the reactive game, okay? So the next course of action must be a smart one, a safe one, and an effective one. One that doesn't make your pain worse, one that allows you to unlock your physical potential in a way that greatly reduces your risk of injury and disease as you age. You need a program that has been designed with you and your weaknesses in mind. Very important point, and a big one that the Reprogram stands for. It is designed for you, right? A program that will teach you about yourself, a program that will potentially save you a lot of money from countless visits to the physio or undergoing life-changing surgery that could have been avoided, right? Worst case scenario, life-changing surgery, okay? Introducing the Reprogram. Right, so I'm not going to go all the way down this, you can read this yourself, but basically what happens is that since you completed, right, so from the moment you completed the mobility assessment, the data from your results was used to prepare your weekly training program, all right? So what the Reprogram does is it takes the data from your mobility assessment and then it creates a program for you. It's completely subjective for you, and it shows you the mobility, the mobilizations that you need to pass before you load your body any further with any extra weight. Okay, this is really important, and that you will not really get in most fitness establishments or gyms. I have never ever been screened. When I joined a gym, there's no one there saying, right, let's take you for a mobility screen, let's see what you're liable for and what your injury risk is before you pick up any of these weights. Doesn't happen, right? This is what this Reprogram is for. It is game changing, right? Hasn't got the attention I've wanted to have yet, but this is why I'm doing this video. I'm pretty sure it's going to change the world. So from the moment you complete the mobility assessment, the data from your results was used to prepare your weekly training program. Your Reprogram is waiting for you on the other side of the Begin My Training button. Lifetime access, and it's going to be a whole comprehensive training program, like a course that takes you through the reset, reintegrate, and this is just a bit about me, blah, 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 blah. It takes you through that whole reset, reintegrate phase. So if we go back to that home page now, and we go down, this is what you pay for. The reset stage is where you achieve an optimal level of mobility that allows you to actively coordinate your joints through a full range of motion, right? That's the first goal before any extra loading or strength training is done, okay? That's what keeps you safe. You have to work on increasing your movement. You will unlock a bit of strength, because when you unlock mobility and make your biomechanics better, you become more efficient, so you will actually be able to shift load easier. It will take less energy for you to shift certain loads and hit certain positions, so you'll feel stronger. Because you would have unlocked movement, you are now no longer fighting against your own stiffness. You are more efficient and you're using less energy to perform the same task. So you'll feel, because you can kind of move and like your joints will feel like they're gliding in a way, rather than being like that, you'll be like, ideal, right? That's where you'll feel stronger. You'll feel more free. So you'll be able to unleash more of a potential for unlocking strength. Okay, that's why this whole thing is banish pain, optimize mobility, unleash strength. That is the stages you do it in. So this is where you kind of clear yourself from risk of injury. The next stage is the reverse poor posture, improve biomechanics by correcting structural and neuromuscular imbalances. So this focuses more on once you get that mobility, we then want to make sure certain muscles are firing in the right order, particularly like things like the glutes, the scapula, the posterior deltoids. These important postural muscles need to be activating and strong, and not weak, inhibited, and letting the muscles at the, let's say, in the hip flexors and the chest overpower and pull that structure in. So that's what the reintegrate means. So it's kind of like basic strength and conditioning, but really working on activation, okay? And then reinforcement is basically develop a strong and athletic physique by increasing muscle mass, bone density, and connective tissue health on top of that foundation you've already built. So what we don't want to do, what we see all the time in commercial gyms, is people will progress, get injured, all the way back worse than they were before, and then what happens is they stop going to the gym because they've lost that motivation. What this is designed to do is to basically never allow you to backtrack. It won't allow you to progress onto the next one until you have passed this variation, okay? You can't jump ahead. You cannot cheat the system. The only way you can cheat it is by cheating yourself. If you press pass knowing you haven't passed it, yes, you'll progress through the system and it will upload the next variation, okay? But the system is done, so as long as you're honest with yourself, it will stay honest with you, and it will give you the right volume, the periodization, and the right recovery, and so on and so forth, to keep you progressing and building that foundation, that solid foundation of physical conditioning, so that you are out of pain, moving well, and looking good, and you'll have, and not only that, but it will give you the knowledge to maintain that all the way up into your late 50s and 60s and so on, of however long you want to do it, okay? So I think that's pretty much about it. The main reason was to show you the mobility assessment, but please go and visit the website, www.thereprogramonline.com. Register, it's completely free. Get signed up, it's completely free, and just work your way through it, and then check out the results page. That results page will tell you so much, and then obviously if you are interested to carry on and fix those, go through the training program.